If I did have to go back, I would be terrified.
I want to talk to those millennials and honestly ask them, when they're looking at the United Kingdom and they're seeing the pain and the devastation that comes from socialized healthcare, is that what you want?
I'm from the United States. I now live in the United Kingdom. I grew up living with type 1 diabetes. I paid quite a lot for my insulin and my supplies and all the things that I need. When I graduated from college, I was off my parents' insurance plan at the time. This was before the Affordable Care Act kicked in. I had to pay a lot of money to be added onto my dad's insurance. I was paying about $1,000 out of pocket every month. Eventually, I got accepted to a master's degree program in the UK, and just being a student here for 6 months allowed me to take advantage of the healthcare system. I was covered under the national healthcare system. I went to the pharmacy and I picked up my prescriptions and I didn't have to pay a huge amount, and that was just really mind-blowing to me. I don't think I'll ever forget that experience. I was just filled with gratitude and in awe of the simplicity of it as well.
Nobody pays a doctor's bill on the NHS. People will go their entire life without paying a single upfront cost.
Is that what you want? Because that is what is coming to the United States if you continue to vote for far-left leaders like Bernie Sanders.
People who live in the UK, they pay their taxes, so they're supporting the healthcare system, but then they are supported themselves. You don't have to battle with insurance companies. You don't have to spend hours thinking about your coverage and where and how you're going to get your essential medicine.
Let me talk to those millennials, like you said, the majority of whom voted for Bernie Sanders in 2016. I want the millennials who think that they love socialism so much to look at what's going on in the UK and see their own future.
When patients come to us, we only evaluate them from the point of view of their need. The cost never comes into it. As a surgeon, I love that because it means the focus is on the care that I can deliver.
Is that what you want?
I'm lucky enough to be able to still live here in the UK, and I'm just always blown away by those costs. I've also been dealing with thyroid cancer this year, and I know that the costs back in the US would just be astronomical for my type 1 diabetes, for my cancer treatment.
The least efficient payers in the world are the American private insurance companies. They have administrative costs of 20 to 30%. That's a 30% tax on every dollar you spend on health care.
I just hope that my generation is paying attention.
I am the founder of an organization called T1 International. We started the Insulin for All campaign, which is people living with diabetes fighting for access. There are people who are dying because they can't afford their insulin.
We had the best health care that could ever be found in any time in history, anywhere in the world.
It really just blows me away that people can say that America has the best healthcare system in the world.
I'll say it. America has the best healthcare system in the world.
It's such a myth that's perpetuated. Having experienced the NHS here in the UK, it's not perfect, but I would take it any day over what we have in the US, which is complete inequality, complete unaffordability for so many people. If you're wealthy and you can afford it, you'll get it, and if not, you might die, and that's really terrifying.
Can you imagine the panic that those patients must be feeling? And they're going to have to wait. And then when are they going to get that very necessary surgery?
And those are myths because I've waited for several months to see a specialist in the U.S.
These kind of stories aren't new, right? Elton John flew to America for a major surgery that he needed.
I honestly haven't met anyone ever who has gone to the States for medical treatment because the treatment here in the UK is not good enough. Maybe the richest 5% or something are doing that because there's something that's appealing to them about healthcare in the States.
Britain is totally socialized medicine, administrative costs 5%. Canada is private doctors and public payers, 6% administrative costs.
People in the UK, they can't comprehend what's happening in America. Most people that I speak to are shocked that it can cost many thousands of dollars to have a baby, for example, or that insulin is costing $300 for a vial.
It turns out in healthcare, governments are doing this more efficiently than our private sector.
People can't comprehend it because to them, health is a human right.
And I just hope that they're paying attention right now, especially to what's going on in the UK.